Well, sadly today we're reporting the deaths of 46 people in New South Wales who have died with COVID. On behalf of people right across New South Wales, can I extend our deepest condolences to all the families, and our thoughts and prayers and hearts are with you at this difficult time. Can I also continue to thank the inspirational work of our health workers on the front line each and every day, our doctors, our nurses, who are doing everything they can to ensure that people are given the care, the support, the love they need and the health care they need as we move through this phase of the pandemic. It's been a very difficult 2 years and our frontline workers have worked tirelessly over that period of time, and over this last month continue to carry out that very important work in our hospitals, in our vaccination hubs right across the state. Particularly as well, I want to thank those workers and pathologists who are out there with the PCR testing as well, because that work continues as we move through the pandemic. Today, whilst it is a difficult day for our state, there are some reassuring signs, and as we've said over the last 2 weeks, that every Friday we'll provide some information in relation to how we're tracking against our worst case and best case scenarios in relation to our hospitalisations and ICUs. And from a hospitalisation perspective today and from an ICU perspective, we continue to track better than our best case scenario. Currently in our hospital wards, we have 2,534 people with COVID. That is below what we were expecting at this point in time, and at a best case scenario we're expecting over 3,000 people in our hospitals with COVID, and on a worst case scenario 6,000 people with COVID. So the figure today at 2,500 provides some reassurance in terms of the situation here in New South Wales. In addition to that, in respect of our ICU capacity, we currently have 209 people with COVID in our intensive care units. That is once again tracking better than our best case scenario from the modelling that we released 2 weeks ago. That was at a height we were expecting 270 on our best case scenario and 600 on our worst case scenario. So the plans that we put in place and the investments that we've made over the last 10 years, but particularly as well at the outset of this pandemic, 2 years ago, where we invested over $4 billion in instilling and building up capacity in our health system here in New South Wales, ensures that we're able to manage as best as we can as we move through this pandemic. So in difficult times, these are reassuring and pleasing signs in relation to our health system. There is no doubt that our health system here in New South Wales is under pressure, like the health system is under pressure right around the country and right around the world. Particularly the challenge that we are also facing in addition to capacity, which whilst is tracking well, are issues in relation to our furloughed workforce. But pleasing signs today, again, we had a furloughed workforce of well over 6,000. Recently, that's now today below 5,000. So there are encouraging signs here, but once again, can I continue to thank our nurses, our doctors, our paramedics who are doing an amazing and inspirational job day in, day out, ensuring that the people of New South Wales remain safe at this time.